So it's my pleasure to introduce Ms. Roshini Youvaraj, a dedicated optometrist with a strong specialization in neuro-optometry and pediatric vision care. So she holds a bachelor degree from Vasan Institute of Research and Ophthalmology, a postgraduate diploma in pediatric neuro-optometry from LB Prasad Eye Hospital, Hyderabad, and a master's in optometry from Shankara Eye Hospital in affiliation with Chitkara University. With over 5 years of experience as an academic trainer, she has mentored and inspired many budding optometrists. So currently, she serves as a neuro-optometry consultant at 3B Eye Care, where she focuses on enhancing visual perception in children with special needs. We are honored to have her with us today. Please join me in welcoming Ms. Roshini Youvaraj. Welcome you, ma'am, as a moderator for today's session. So the topic for today's session is going to be progressive myopia, and presenter is Ms. Shainsha, third year student. So welcome you. So we can.
Thank you, Madangi. That was a very positive introduction. Yeah. So can they start with the presentation?
Yes, sure.
Yeah. Do you want us to share this?
Good afternoon, everyone. This is Shainsha, third year optometry student from IVM College of Optometry. And thank you for the opportunity that you have given me. And today's case presentation topic will be progressive myopia. Could you please go to the next slide? Yeah. His name is not mentioned here, and the patient's age with chief complaints of blood vision and bitemporal headache, which was progressing during the night time. And only with painkillers, the pain was subsiding, and throbbing pain, continuous pain. And when we investigated on the systemic history, the patient had a history of thalassemia. And he has also undergone a bone marrow transplantation before 8 years. Currently, he is not under any medication. There was no allergic history. His family history has been completely normal, and there were no ocular complications or past ocular history. His lifestyle was only 2 to 3 hours of digital device usage and good sleep cycle and good food habits. Next slide, ma'am. Okay, when we did the vision assessment in unaided, in the right eye it was 6 by 36, and in the left eye it was 6 by 24. When we checked for the aided visual acuity in the right eye, in both eyes it was 6 by 9, and the visual acuity using pinhole was 6 by 18 parts in the right eye and 6 by 12 in the left eye. Next slide, ma'am. When we did the refraction, the objective and the subjective values were minus 3.50 diopters for right eye and 3.75 diopters for the left eye. And the visual acuity improved to 6 by 6. And it was also verified with duochrome and JCC. The previous prescription was minus 3.25 in the right eye and minus 3.50 in the left eye. Next one. On anterior segment evaluation, all the anterior segment evaluation was normal. The lens was clear in both eyes. The conjunctiva was normal, and the cornea was clear. The anterior chamber was within normal limits. The lids were normal. The pupil was normal and was reacting to light. On further investigation, we went on an A scan, and it is noted that the axial length of the eyeball is comparatively higher in the right eye than the left eye. It was done using an IOL master. Next slide, ma'am. And on final diagnosis, it was diagnosed that the condition was progressive myopia, and the management was planned, in which the doctor suggested on myosmart lenses from Zeiss, and further it was planned for shifting to ortho-K lenses. The patient was also given counseling on exposure to sunlight, which will increase the dopamine and reduce the axial length elongation. Next slide, ma'am. Something I found highlighting on this case was it was the progression of myopia was continuous for every 2 months. On every 2 months average, the patient was changing his or her spectacle. And the prevalence of, and the other thing which I learned from this case was the prevalence of refractive error was more in thalassemia patients. Then the other thing was the practitioners were trying to combine both the clinical and the other part of lifestyle changes that is the raised focus in front of the retina and with 0.50 diopter or more increase in an annual. The pathophysiology is completely based on the genetic and the environmental factors, and it is axial elongation and the remodeling of the sclera. Next slide, ma'am. Ma'am.
Shainsha, I think your audio we are not able to hear properly. We are not able to hear you, Shainsha. Am I audible?
Yes, ma'am, we can hear you, but on and off, Shainsha's audio is going off.
Yes, yes, ma'am. So can you correct it, Shainsha?
Now is that okay, ma'am?
Yeah, now
Yes,
we
yes,
are.
Shainsha. Can hear you now. I think you should relocate your, where the Wi-Fi is more prominent.
Is it okay now?
Audio is very low, Shainsha.
Okay, just
Hello, ma'am. Hello.
Yes, now it is clear.
Hear me? Am I audible?
Yes, loud and clear.
Yeah. Would you like to repeat some slides or do you want me to continue? Should I repeat or
Can we go from the
can
scope
I
of
continue?
myopia?
Yeah, yeah. Okay, myopia is basically a nearsightedness, which is in which the axial length continuously gets elongated, whereas in progressive myopia, the condition worsens over time, typically with an increase of 0.50 diopters or more annually. Pathophysiology is continued axial elongation and scleral remodeling occurs in this condition. Next slide, ma'am. Okay, this factor include early onset, which is myopia develops usually around the age of 6, and parental myopia, which increases the risk of myopia, which is passed on genetically to the children from the the Asian populations have higher myopia compared to other activities and excessive near work, proximal detachment, myopic maculopathy, glaucoma, and cataracts. Monitoring regular cycloplegic refraction is required. Axial length measurement, fundus imaging can be used for monitoring the growth of myopia. Okay, management strategies include atropine therapy. Low doses of atropine has shown efficiency in slowing progression. Orthokeratology, this is also an contact lens method, overnight contact lens, effective in children with high myopia. Multifocal contact lenses help in reducing myopic progression. Lifestyle modification, which is increase in outdoor activities and reducing the near work, will decrease the progression of myopia. Guidelines, the international committee has recommended structural approach for measurement and monitoring and management of myopia, uh, which is measurements will include all the assessment for myopia, which is like axial length and curvature based measurements, all those, and monitoring is regular monitoring in which the oxygen carrying hemoglobin, there is a very decreased blood count which will lead to anemia. Can you please go to the next slide, ma'am? Okay, I'm coming to the association between thalassemia and the ocular changes. In children with thalassemia, will often exhibit shorter axial length, which is decrease in axial length. That is microcornea, anything like that could happen, and curvatural changes, which is the curvature of cornea becomes steeper in case of thalassemia. And lens thickness increases to compensate this short axial length, only through. Coming to the ocular manifestations of thalassemia is retinal abnormality.
Shainsha, your audio is not clear. We are not able to hear you.
Such as retinal pigment epithelium degeneration and observed in these cases. Lens of in major patients with. Oh, ma'am, is it okay, ma'am?
Yeah.
Is
On
it
and
okay,
off, we
ma'am?
are not able to hear. Now it is better.
Yeah. Lens opacities. There is a significant lenticular opacities are seen in patients with thalassemia, and the prevalence rates actually increases compared to the normal patients. Um, iron overloaded effects. This give rise to deposition of iron on cornea or any other ocular structures. Can you go to the next slide, ma'am? Okay, genetic consideration. Um, genetics play a crucial role in myopia, that is TGFB1 gene. Polymorphism of this gene can cause high myopia, and COLA1 gene polymorphism of this gene can also induce high risk of myopia. The conclusion is there is no direct link between thalassemia and the progression of myopia. However, retinal abnormalities and that deposition of iron are seen in most of the thalassemia patients. These evaluations are essential for early detection and management of potential ocular conditions. Um, but in the case which I explained, the thalassemia due to thalassemia, there is an evidence that the axial length is shortening. Myopia. Evaluation and detection and evaluation is required for detection in the condition, detection of the condition, and managing the complications arising due to it. Um, uh, thank you, thank you for the opportunity. Is there any questions?
Thank you, Shainsha. So, thank you, ma'am. Roshini. So, let's add on.
Could you please repeat the question, Madhangi? Was there any question?
Students, do you have any questions? Interns, externs? If you have any questions, you can post it in the chat box or you can unmute and ask.
Meanwhile, can we discuss about some crucial part of this case?
Sure.
Yeah. So if you see in this case scenario, mostly the myopia it is divided like pathological and physiological, right? So in this case, there is two different things which is being addressed. One is your progressive myopia, and the other thing is thalassemia. So the prevalence of thalassemia could be lower compared to the prevalence of myopia globally. If you see, the management part of this case was really it was like cakewalk. First, they started handling the myopia progression using a combined strategy. So earlier, they were using only one strategy of like managing the myopia, like giving a spherical lenses or giving a single vision lenses with like lot more aberrations in it. But nowadays, even the clinicians they are very aware about all the combined strategies in the right now scenario, like updated one. For example, using the lenses, the myopia control lenses was a very good initiative in the starting stage. Then, when the child is good enough to accept the orthokeratology, the doctor may prescribe an orthokeratology which can really work on reshaping the cornea so that the myopia progression can be controlled drastically. So for a change, this case can be an eye opener for all the clinicians and also the students who have participated in the webinar. So sticking with the old traditional ways of giving management is okay, but implementing new strategies and new current updates into the clinical practice is very important. Can I have more questions? Is there any question? Madangi, is there any question in the chat box? Can you please help me with it?
Yeah, sure.
Yeah.
Students, do you have any questions? It's an interesting case study. So you should have got many questions while presenting itself. So, any questions you can post it in the chat box, or you can unmute and speak. So we have Ms. Roshini ma'am here to clarify your doubts. Any questions, students?
Yeah, even you can discuss about the cases, what you have handled in your OPDs, and yeah, that will be very interesting to discuss. Okay.
There's a question in chat box, ma'am, about orthoconal lenses.
Okay. So if you say orthokeratology, it's a booming contact lens practice right now, which is happening in India, and it's already established in overseas. If you see orthokeratology, earlier it was determined like only for students, or only if the age criteria is more than 18 or 19, we used to prescribe. But nowadays, the recent advancement, orthokeratology can be given to 6 years old, even 6 years old. But parents, they should be mentally open to get to adapt to the new treatment strategies. If you see orthokeratology, it's an overnight hard lens which you keep it on the cornea while you sleep. If you see the normal contact lens, you will wear it in daytime when your eyes are open. But if you see orthokeratology, you will keep it in your eye while you sleep. So what happens if you keep it overnight? It reshapes your cornea so that the axial length is again brought back to the normal. But if you see orthokeratology, you have to use it consistently over a period of time. You may see some drastic difference of your axial length too. And the myopia, the progression of myopia can be restricted, and it can be a very good non-invasive method. For example, if you see the orthokeratology, it's kept over the eye, means over your cornea, and all the other pre-assessment is done. So this can this can help you so much, so that it can reduce the progression in earlier phase of life with the recent advancements. Did I answer a question?
Yes, there's another question, ma'am.
Yeah.
So how do we decide the urgency of intervention in a child with increasing axial length but no fundus changes yet?
That's a very good question. So no fundus changes. In this case report, uh, the the protocol or the procedures what they have done, they missed out the fundus photography. But in to start with a myopic investigation, you should go with a proper fundus. But in your question, if there is no fundus changes, yes, initially the clinicians will start with atropine. But if there is any side effects, yes, you can go with orthokeratology in earlier stage itself. About neurooptometry.
About neurooptometry.
Thank you, Kirtika. So, what do you know? What do you want to know about neurooptometry?
Ajit, can you unmute and speak? What was your question? What do you want to know about neurooptometry? Ajit, can you hear? Can you be more specific on the question about role of an optometrist in neurooptometry?
Okay, I'll get back to the neurooptometry, role of the neurooptometry. Okay, so generally in a comprehensive workup, you include all the visual function assessment, and it works on your accommodation, retina, and all these parts. So basically, your visual function is nothing but talking about your retinal lesions, and also talking about any ocular structural changes. Okay, in the comprehensive. Coming to your neurooptometry, it is related eyeball and the brain. So the test which is done to relate or to understand the relationship between your eyeball and the brain is very crucial to work on vision perception and also vision therapy. Yeah. So to start with, like neurooptometry, if you see, even if you take a pupillary examination, in general comprehensive OPD, we just do the shape, size, and color of the pupils. But later on in neurooptometry, you see the reaction of third nerve, and you see how it is working. If the third nerve palsy is present, you may not see the constriction of pupil, and convergence can also be restricted, right? So, from the structural change to shift your mind towards brain and eye is something called as neurooptometry. Did I answer your question? Thank you so much.
There
Yeah,
is one more
some,
question.
yeah,
Power ranges
please.
of ortho K lenses.
So if you see, it is there up to 10 to 12 diopters, but recently we have hybrid combination. So if you talk about hybrid combination, it's a combination of both soft and hard parts. So if you see the center portion, your optical zone will be in a hard portion and your peripheral portion will be a soft portion, which is replicating your piggy bank lenses. Okay, so in that you have still more variation. Now, currently in the clinic practice, we are doing up to 12 diopters. Yeah, thank you.
So, ma'am, we have another
Yeah,
question from Kritika. So,
yeah.
can lifestyle intervention alone be sufficient in controlling myopia, progressive myopia in high risk children's?
High risk children, kind of, in the sense, if the parent, if first we should be very clear about the high risk children. Okay, most of us we think if parents are having myopia, we may, or the child may have the myopia too, but there is only 40 percentage of prevalence from the parent. Means the incidence of myopia in a child could be only 40 percentage, and that also can be restricted well if they start controlling like immediately after the birth. So most of the children, they are always hooked up with their phone, even like from 0 to 3 years old. That is the process, or that is the stage of emetropization, which means the eyeball is slowly, it is growing to a normal eyeball. So if you restrict or if you control the phone usage in that particular time, you can cut down that what to say, that myopia incidence. And apart from this, lifestyle, yeah, really lifestyle can change a lot of thing in myopia. 60 percentage of lifestyle change can impact the myopia changes in them. And hereditary, yeah, hereditary we can't do anything, but controlling like good lifestyle with restricted screen usage uh, uh, can control myopia progression. For example, can I share one case, case what we have seen here in the OPD, Madangi? Is it okay?
Yes, ma'am.
Do I have
Yes.
time? Yeah.
Sure, sure.
If you see, I had two different children. One child, like their mom with the mom was coming with them. So what happened? The child was not having any progression over 2 years with myopia. So she was having around point like -1 in the starting phase, and even after 2 years, the power was in the stable manner. Why? Because I asked the parent to. What she told was the only screen time what they're providing to the child is 1 hour per week. Can you see this? 1 hour per week. If you see same age group, but the child like the same age group, but when they were using the gadget for multiple time or even like more frequently in a daily basis, they were having a huge amount of progression, right, from 0.5 to -4. So that was a transition in 2 years of span. So if you see, yeah, lifestyle plays a huge role, if I'm not wrong. Did I clarify your answer? Like your question, sorry.
Definitely, it was a very great explanation. So, children's, was it useful? So, do you have any other questions? Do you have any other questions, children's?
Thank you. Thank you so much, Kritika.
Do you have any other questions, children's, to ask? If all doubts are clarified, can I have a thumbs up symbol? Can I have a thumbs up? No more questions? Can we wind up with the session? Okay. Thank you, Session.
Thank you.
Thank you, ma'am. Thank you so much. for giving your valuable insights about the case. So it was a very wonderful case, and looking forward for many more sessions with you like this. And thank you, Shainsha, for her presentation. Thank you so much, ma'am.
Thank you so much. Like it was a very good interactive session, and yeah, connecting with so many people was so good. It felt good. I hope people receive the message what we are trying to tell. And if in case if there's any doubt, you can call me anytime, and we can discuss about this. I'll be very happy
Sure.
for that. Yeah,
Sure.
thank you so much, Madangi, and thank you for the opportunity from Dagabals. Thank you.
Thank you. Thank you so much.
Yeah.
Thank you. Thank you, students. Thank you all.